The Healthcare Transformation Lab at Intermountain Healthcare is a section of the organization that's really focusing on making a better patient experience while they're in the hospital. It's part of our shared accountability strategy, and the first phase of that strategy is to identify efficiencies while the patient's in the hospital and making the quality of care better. One of the things we're doing is we're re-looking, I should say, at the patient room. You've probably heard of lots of things about the patient room of the future. Well, we're trying to actually bring that into existence here within the next 18 months or so. So one of the things that we do at the Health Transformation Lab is we have a mock patient room, which is really designed to the same specifications as a patient room that you would find in one of our hospitals. We have a patient bed, we even have a mock patient. But what we've done is we've really tried to rethink how the patient's experience is. So while most patients do have a TV, we're rethinking about how the TV in the patient's room can facilitate the patient's stay. One of the obvious things that we're trying to do is bring telemedicine into the patient's room while they're in the hospital. So we are mounting a camera in the patient's room. That's been done. That's not too forward-thinking, but we're putting it in every single patient's room in the hospitals across 22 hospitals in our system is a little bit more forward-thinking. We're also having a server in the room where we can use that to push patient information, patient content, patient education, patient entertainment, all sorts of different things to help the patient understand not only why they're in the hospital, but what's going on around them in the hospital. So we can bring virtual services to the patient's room. Certainly we can bring their primary care physician into the room, but we can also bring other services like interpreters into the room virtually almost instantaneously. We can bring a pharmacist, a case manager. We can have the home health nurse virtually present in the patient's room during discharge, that exact same person you're going to see when you go home. The other thing that we're going to do, and we're committed to letting this technology be used by the patient when we're not using it as an organization for healthcare services specifically. So if we're in Utah and the patient has a daughter in Florida, well, we'll allow the patient to do a video chat with that daughter from Florida just for the comfort of the patient. But we can also bring that daughter from Florida in for a conversation about how their family member is doing. It certainly allows their children, or in the case of a child, the parents, because we're looking at cribs and other types of things too, to be available when the doctors are doing rounds, when quite frankly a lot of them still have to go to work and they can't sit in the patient's room all the time. We're certainly also thinking about reimagining the pillow speaker concept. We're looking at using touchscreens in place of the typical plastic shelled pillow speaker. This allows us to create a dynamic experience for the patient. So if the patient speaks a different language, such as Spanish or Arabic, we can flip that whole pillow speaker to be in Spanish or Arabic for the patient. We can certainly push all the patient information and patient educational content to that touchscreen, as well as push entertainment. So anything that you do online, from play Angry Birds or cut the rope to listening to Pandora or reading Google Books, we can certainly push to the patient. We can also let them log into their own Netflix account or see movies or watch NBC or ABC online. We think these are wonderful things to enhance the quality of the patient's experience in the hospital. We can also send them updates to this process as well. So we see this as a very dynamic, personalized experience, and we're calling this the personalized patient room, or personalized patient experience.